रूम बंद है ना, ऐसे चालू ऐसा।
So, hello all the viewers of Homeo Health channel by Dr. Varsha. Today, it's a new time, new day. As you all know, Sunday I don't do the live, but this time जो speakers हैं वो इतने ज़्यादा खास है कि उनके लिए मैंने अपना schedule Sunday का भी रखा है because I really wanted him to come to my channel and he's a very busy practitioner, so I decided to come on Sunday. Now, today's topic you all know is utility of homeopathic Boericke materia medica in day-to-day practice. Why I have chosen this? ये एक ऐसा टॉपिक है कि वैसे जनरलाइजली हम सभी को पता है कि हमको बोरिक यूज करनी चाहिए, लेकिन बहुत सारे ऐसे प्रैक्टिशनर्स हैं, स्पेशली अर्ली प्रैक्टिशनर्स या जस्ट प्रैक्टिस स्टार्ट करना चाहते हैं या अब होम्योपैथिक में कन्वर्ट करना चाहते हैं, उनको बोरिक तो होती है लेकिन बोरिक का मैक्सिमम यूटिलाइजेशन पता नहीं होता है. द रीजन वी आर नॉट टॉट लाइक दैट इन अवर स्टडी लेवल. We don't know the exact importance. Boericke is so complete in itself कि you can even if you ever have seen any practitioners from Kolkata, you would see that they have maximum practice utilizing the Boericke in their day-to-day practice. So if you have a very good knowledge and you know how to utilize it in day-to-day practice, definitely your practice level would be high and आपको बहुत अच्छा लगेगा, आपके cases बहुत अच्छे solve होंगे, easy to practice हो जाएगा और आप डे टू डे प्रैक्टिस में बहुत इजीली अपने केसेस सॉल्व कर पाएंगे. तो इसी टॉपिक को लेके मैं ऐसे स्पीकर के साथ आई हूँ जो बोरिक के साथ 24 आवर्स रहते हैं. आफ्टर डॉक्टर सरकार सर, इफ आई नो एनीवन हु हैज अ वेरी डीप एंड वेरी प्रिसाइज नॉलेज ऑफ बोरिके is Dr. Rajiv Karia, today's speaker, who understand the Boericke in and out, who have digested the Boericke in his day-to-day practice. अगर आप उनकी बोरिक देखेंगे, I will ask him to show you. He has marked every particular line with different colors. And recently we have attended a Pune seminar jointly. And sir जब cases दिखा रहे थे या कोई medicine discussion कर रहे थे, and Dr. Sarkar has an habit of doing it कि he explains the symptoms and then we have to guess the remedy. And the only person who can guess the right remedy is Dr. Rajiv Karia, sir. So I'm very glad that he is the today's speaker and he is explaining us the very importance of Boericke. And you all know Dr. Sarkar is very fond of Boericke. So talking about Rajiv Karia, sir, I think maximum of people might be knowing him, but the people who are unaware of his dynamic personality, I would say, he is a very renowned homeopathic practitioner in Vadodara, Gujarat, and he has been practicing since 25 years. He has dedicated his life for 25 years in homeopathic practice, and for that, he has been awarded recently in the International Homeopathic Seminar in Pune, conducted recently, like 7th and 8th of this month, and he has been awarded by as a renowned homeopath of or promising homeopaths of today's generation. So very congratulations to sir about this. And talking about his achievements, so he has done his BHMS from the very earliest homeopathic college in Gujarat, that is Gujarat Homeopathic Medical College, Savli, Gujarat, in 1998. And I was very young at that moment of time. And then he did the orientation teaching training program from the NIH Kolkata. Then he had done his PG homeopathic course from the Hahnemann College of Homeopathy, London. Then he has even had a diploma course from the International Classical Homeopathy, Greece, under the guidance of George Vitholkar, sir. Then CCAH certified course from MIUH, Maharashtra University, Nasik. He has also done his fellowship from MIUH and stood second in the university in CCAH. So that's how, and he has thousands of cases. Recently, he has posted his whole clinical journey and he has successfully treated thousands of cases in his life with a very good approach and very simplified way of treating the patients understanding that between the lines of the remedy. So welcome, sir, on our channel.
Thank you.
And I'm very glad to welcome you.
Same here.
आपके लिए मैं जरूर कहूंगी देर आए दुरुस्त आए. Due to some of the consequences, we could not match our days and dates, and we could not go live because we were planning since long. But दिवाली खुशियां लेके आती है, वैसे ही सर हमारे चैनल पे एक बहुत नॉलेजेबल खुशियां लेके आए हैं, क्योंकि शायद ये दिवाली का ही फेस्टिवल आने वाला था और तभी हमको लाइव आना था एक दूसरे के साथ. सो आई वुड वेलकम यू सर ऑन माय चैनल, and please tell us your journey about homeopathy for 24 hours years, how you experienced homeopathy in your day-to-day practice.
The journey was little tougher, and it's all started with Savli College. One
Yes.
of the sir told me, "Why did you came to homeopathy?" So I just answered that homeopathy runs in my blood. So every member of the class laughed at me. "अरे ये क्या बोल रहा है? What he is saying?" And one day it came true. So what you say, no, that becomes true as Saraswati stays in your mouth, no?
Yes.
So we should be very careful what we are saying. So
Exactly.
that was the journey, how I started with my homeopathy. The days were very tough because to pay fees of my college was also a tough. And I used to practice at the time I was admission time. I used to practice and I have to earn, and then I have to pay my fees of the college. So that was so much difficult at the days. And the day when I bought my cycle was very happiest day.
Oh.
Cycle was also very difficult to buy at that time. So that was a very tough days. Then I got the support of my father, who was also a staunch believer of homeopathy, and the blessing of my father and mother. I could be very successful from the starting itself.
Right.
Very, getting success in homeopathy is also a big challenge.
Right.
And then I did a course of Swami Sivananda from Haridwar, and there I used to give remedies to mama who comes laborer, and that how I learned application of homeopathy.
Okay.
Aconite, belladonna, and everything I used to give to poor people. So best way for the young students, start giving the remedies without any cost. So we learn from those poor people, because poor people are they are not compensated. So they will speak from their heart. So we learn more from them. The application of new remedies, application of common remedies, you will be able to learn from those people very well.
Right.
Then I started, doing camps. Camps also helps you more to learn remedies. Application of, I can give an example of coccinella, which I learned by giving from the camp, and it is very good drug for dental pain.
Right.
So these are the smaller remedies that you can learn by organizing camp. And then the journey went through. There were difficult days also where I had no clinic in the year 2012. Then clinic stopped. Then again, second clinic came in 2016. And this is my third clinic.
Okay.
So this is almost 7 years of my third clinic.
Right.
So changing places, problem is there. That's the thing. That is the journey that I went through. It was a very tough journey, not a easy cakewalk journey. But when the tough things are there, you learn so much.
Yes.
And attending so many seminars, webinars, learning today also from Varsha also.
Sir, don't say that. I'm so glad to hear that. But
we have to learn from everyone.
Yes, I am totally agreed to you, and I tell you, my viewers, कि सर का आज भी ऐसा है at this age he is very fond of seminars and webinars, and he attends maximum. इतना तो आज के generation के students नहीं attend करते, उतना मैंने सर को देखा. He has a very vast knowledge and still he improvise it with every speakers. And I've seen his dedication for 2 days in Pune seminar, that he was constantly, वो एक ही थे जिनके पास अलग अलग मार्कर्स थे, एंड वाज कॉन्स्टेंटली राइटिंग 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 राइटिंग. वी हम थक गए थे, लेकिन सर वाज नॉट, बिकॉज वी वर सिटिंग टुगेदर and we were like, see, he's so inspiration for us कि at any cost, any age of life, you are a student of homeopathy. You cannot claim we know everything. So that how he's too much inspiration for me as well. Continue, sir.
Yeah, that's the thing, You can ask any other questions.
Yes, sir. सर, जैसे कि हमने आज बात की कि हम बोरिके के बारे में बात करेंगे, तो can you please summarize a small introduction about the Boericke? Who was Boericke and how he approached in this book? कैसे उन्होंने लिखा और क्या क्या उसमें pointers हो सकते हैं ऐसा?
William Boericke is the main author of this book, Pocket Manual of Homeopathic Materia Medica, and he was born in 1849, October 25th. So he's a super genius person, and he was Austrian born and practicing in America. He practiced for almost 50 years in America. And he wrote this wonderful pocket manual, Homeopathic Materia Medica. And the first edition that came in the year 1901. 1901 was the first edition of Boericke.
Right.
And then total 9 edition came. In the third edition, it was very interestingly, he added repertory by Oscar Eugene Boericke. Oscar Eugene Boericke was his brother, and he added small repertory, which was a clinical repertory. It is called General Clinical Repertory. He added at the third edition, and third edition was in the year 1906. So where this was added. And little bit more about William Boericke. He was a 50-year-old practitioner, and he could add many remedies. I would like to share there are 1409 remedies in Boericke Materia Medica. If you see T.F. Allen, Encyclopedia of Homeopathic Materia Medica, that book has 1039 remedies. So you can see the huge difference of remedies that is being contributed by William Boericke. And if you see General Guiding Symptom by Harry, it has more than 400. I think it is 439 remedies were added. And you can see the difference of Boericke from Allen Encyclopedia and Herring the Guiding Symptom. So you can see the vastness of the Materia Medica which was put by William Boericke. The contribution was given by Clark. Clark had this clinical repertory in 1904. That was the first clinical repertory before Boericke. So Clark contribution was also there. Then contribution was done by Burnett, and Burnett could add many remedies. And then last was the Cooper, and something about the repertory part. So repertory part is very interesting part, which is a clinical part, and the short clinical glimpses were added at the time of Hahnemann. One thing was very interesting about this repertory is those persons were very, dare to be wise. They were audacious. They could bring about the clinical part of Boericke repertory, because clinical part was not so prominent at Hahnemann time. Hahnemann was in the individualistic way of understanding, where the mental symptoms were taken so much. At that time, the Boericke was being introduced. So this is the scenario of Boericke, how the Boericke was introduced at that time, where things were more on the mind part or the physical part. The clinical part was not so much at that time. As you know, it was almost 250 years from now. So now the clinical part, still now we use for clinical Materia Medica and repertory. You can see that. So huge difference. many rubrics still we don't know. This is a very interesting repertory that we have nowadays.
Right.
So it is very helpful in our clinical practice.
Exactly. Sir, Boericke has multiple chapters inside it, right?
Correct.
So can you explain students or today's viewers
Hmm.
कि उसका स्ट्रक्चर कैसे फॉर्मेट हुआ
Correct.
है,
Correct.
क्योंकि हम यूजुअली उसमें से मैट्रामेटिका ही यूज करते हैं, लेकिन
Correct.
आई
Correct.
थिंक बोरिक हैज मच मोर थिंग्स,
Correct.
more than a matematica. Okay,
Correct.
so
Correct.
what part we should understand and कहाँ कौन कौन से पार्ट को ज्यादा इंपॉर्टेंस देना चाहिए, क्या
बिल्कुल
करना
बिल्कुल
चाहिए सर?
बिल्कुल बिल्कुल. Repertory part has 25 chapter, which is taken from Kent repertory, and it is it is divided into location, sensation, concomitant, and modality, like an Boning lesson. So very interesting part is being done in this clinical repertory, and the latest ninth edition, which was published in the year 1927 in the month of June 27. So very interestingly, he added Indian drugs. Indian drugs are the excellent addition in the ninth edition. Then came the mother tinctures. Then the role of nosode and sarcodes that we study. There is therapeutic index, and index to the repertory is there. Then the sides of the body. This is very interesting topic that one should know. It is taken from Wernicke's and lesser writing. So it is
Right.
necessary even to read Wernicke's and lesser writing. The sides of the
Okay.
body and drug affinity. Very important, very important chapter has been added in the Boericke repertory. And then last, the abbreviation, list of all the abbreviation. And one abbreviation is taken from the synthetic repertory. So these are the
Okay.
very interesting things that have been added into Boericke repertory. So Boericke repertory is
Okay.
must for certain clinicians, those who are working very fast in and out of the patient. If you know all the rubrics, I think there are 8,309 rubrics that have been written, and for 1,405 remedies in repertory and 1,409 remedies in Matramedica.
Oh,
So the Boericke pocket manual is divided into Matramedica and the repertory. So repertory has little limitations also because it was addition by Oscar Boericke, and he was also a practitioner in America, and both have contributed very well.
right.
That's just it.
सर, हमने ये तो समझा कि स्ट्रक्चर क्या है, राइट? हाउ इज द
Correct.
स्ट्रक्चर ऑफ द बोरिक, बट how to read Boericke is
Hmm.
very, very important, because I see the people's, as a student, we don't more focus on the Boericke. We focus on other student-based books. But I think Boericke has more clinical approach. To practice, you need a Boericke. So, how to read each remedies, or what approach should a student should have to understand the remedy in their practice?
Very interestingly, to read and memorize, you have to come into the practical aspect of the life. If you are
Right.
moving, think about Boericke. If you are eating, think about Boericke. If you are breathing, think about Boericke. If you take into your own life, practical life, when you are moving the hand, think about Boericke. When you are seeing something, think about Boericke. Because Boericke is kind of a Bhagavad Gita, no? When Bhagavad
Exactly.
Gita, when you are reading, no, you have to apply in your life. You need not to memorize. For example, if you are reading a newspaper, आपको याद रखना पड़ता है न्यूज़पेपर में आज ये न्यूज़ आया, ये आज इंग्लैंड और इंडिया की मैच है, याद किया आपने, ओ आज इंग्लैंड और इंडिया की मैच है, आज इंग्लैंड और नथिंग टू मेमोराइज, इट विल कम बाय इट्स ओन. You have to live the life of our mathematics. You have to
Exactly.
breathe mathematics. You should live mathematics. You should eat mathematics. For example, if you are eating biscuit, think about plumbum mat. So plumbum has desire for biscuit because in a chronic kidney disease, this plumbum will desire lot of biscuits. Even I have this patient who has tremendous craving for biscuit in chronic kidney disease. This is how we should relate our Boericke with desire and aversion, modalities, concomitant, generals. These are all very important. Very
Right.
interesting thing I would like to add is the italics of the Boericke materia, which is in 2 marks, which are frequently verified clinical symptoms. I'm repeating myself, it is frequently verified clinical symptoms. You can bet that the drug will work. I will give you a very interesting example of a Dalkamara where the word cold has been written 26 times. You
Oh,
go home and read your materia medica of Boericke and you underline cold. How many times Boericke has written cold? From that cold, you can understand the core essence, genius of Dalkamara is cold. Anything that is aggravated by cold, first we should think about Dalkamara. Dalkamara is from the Solanaceae family, and you will see there is huge difference you will get in your practice. Second is the serious memory. The how we should know our drug is on the sphere of action
exactly.
and the core and the base. We have to make correlate the core of the patient with the core of the materia medica.
Right,
That only will cure because the similia similibus curantus. Let's like
right,
be treated by like. That is very, very important. It is not like cure like. It is let like be treated by like. So any
right,
drug which produce will also cure.
exactly. Sir, I have heard somewhere, I don't know this is true or false,
Yes.
but I have heard that आप जब सेमिनार्स के लिए ट्रैवल करते हैं तब
Uh,
आप बोरिक को साथ में लेते हैं और उसी को एज अ पिलो भी यूज करते हैं और उसी को पढ़ते हैं उसी के साथ बैठते हैं उसके साथ उठते हैं इज दैट
uh,
ट्रू?
okay, I'll answer that question. Uh,
Yes,
See, when you read, no, you have to follow certain norms. So
yes,
read, write, memorize, and last thing is recall. What mistake that we do, no, we don't recall. घड़ी
yes,
घड़ी अपने मेहमान को बुलाना पड़ता है तभी मेहमान को याद रहते हैं कि भाई मेहमान ऐसा था या उसने मुझे चाय मांगा या उसने ऐसा शर्ट पहना था ऐसा चश्मे पहने थे टीका लगाया था these are all things that we have to remember everything how that the patient as a persona is so when I memorize I put my Boericke and just recall everything what I've learned if you don't recall you will never remember I can bet on that.
but you do it on traveling also.
Yes, I have to see
I've heard this
external.
before 12 years. You
Nee,
don't know that, but I've heard this before. I was actually practicing, taking my lectures in Pioneer, and that moment of time, somebody told me that Rajiv
correct,
sir does this while he's traveling to the lectures at Bombay, and he has a
correct,
habit of carrying the Borik everywhere. And he
correct.
does this. He read and then put it beside him, and then again he start reading it. So
Correct.
during traveling, also he is very fond of Borik. So you might
So,
not be knowing the story, but I know you since then.
eh,
Okay, sir. So coming back to our topic,
yeah,
uh, usefulness of boric in clinical practice. This is very important. See, today we have a bunches of books with us talking about materia medica of age drug, right? Starting from Fatak or Boericke or Allen or any other specific authors have written it. Now,
mm,
students becomes very confused which one we have to use and how useful it is for our clinical practice. So, according to you, how much the Boericke has its utility and usefulness in our clinical practice from your experience?
Boericke is the life that we learn from. For example, now we have attended Navaratri session, right?
Yes,
नवरात्रि में हम लोग डांस करते हैं हंसी खुशी करते हैं रोज तो हम इतना एक्सरसाइज करते नहीं है वी डोंट डू एक्सरसाइज such a amount no almost 2 3
yes,
hours in Baroda it is very famous Navratri the person
yes,
start dancing from 10 p.m. to almost 2 a.m. in the morning. So
yes.
much
And that is
power that
constant,
comes.
constant without
Constant,
break.
yes, yes. And there is very interesting drug that I like to share with you. And I'll read this line from Boris. What is written? It is written, the drug is gives power to endure prolonged physical exertion without taking food and without feeling hungry. See, this is the application of Boericke. you have to open kola nut. If you open kola nut, this is the line that is being given in Boericke that
Yes.
will know that will give you the insight of this remedy, kola nut. Basically, it is the remedy used in Coca-Cola. Do you know Coca-Cola? I think you
Yes.
must not be knowing Coca-Cola. The olden days, this Coca-Cola was used as an energy drink like Pepsi and Gold Spot and all that. This kola nut forms a Sterculaceae family. This is Malvaceae family. So that when you drink kola nut and you get a lot of power.
Oh,
And Navratri mein we do fasting, no? So without any taking any food, you go on dancing. If you take few doses of kola nut, I have given to my some of my patients and they have appreciated like any. Second drug which is very interesting is coca.
okay.
Kola nut and coca. When someone tells you in the Diwali vacation, we are going for a mountain like Leh and Ladakh,
Yes.
think about this coca. It is mountainer's remedy. No? So this remedy, if you read from Boericke, no, will get excellent insight into the coca. Now,
Yes.
coca is very interesting remedy for COVID cases also, which I have given in COVID,
Right.
where the oxygen level starts increasing when it seems as if the man is traveling or climbing a mountain and the oxygen is dropping. So think
Right.
about coca in 30 potency in you can apply in certain cases, definitely. And
Yes.
it works. I can bet on that. It
Yes, I
definitely
have
works.
one experience with me with the coca, and one of my family friend were going to Ladakh, and we have prescribed that medicine to them, and they didn't had that epistaxis during that high altitude as well. And the others who have not taken the coca, still they had that remedy and didn't took it. They had the epistaxis episode and the fluctuation in their blood pressure. So coca has a very this peculiar application in clinical practice. Yes, sir. Carry on.
There
Do
is
you
another drug,
share some
Verbana.
verbana?
Verbana.
Okay.
Wonderful remedy that are used in epileptic cases. It, it, it is written in Boericke that it will enlighten or brighten up the mind. No? Verbana you should give to the epileptic patients also.
So,
No?
one particular question:
Yeah,
it
yeah.
should be used during an attack or to avoid the attack, or as a constitutional, how you approach with the
Correct,
verbana?
correct.
Yes.
See, it can be used as an acute remedy or it can be used as a pathological remedy in epileptic cases. If
Okay.
the cases are of epileptic attack and the patient tells you, I am very much exhausted after this epileptic attack and my brain is almost like a brain fag, you should start give Varban.
So
It
after an
brighten
attack,
up.
we can use as an post-epileptic attack
Yes, post
symptoms.
epileptic attack, or it freshen up the brain enlightenment, it increase the no, circulation of the brain. This is the effect of Varban.
So anyone who has a senile changes and had a difficulty of blood rush to a cerebral part, can we
Correct.
use the Bharvana for that purpose also?
That purpose also, or if there is a past history of epilepsy, the Varbana can be used. Another drug very similar is vanadium. So
Yes.
vanadium has lot of degenerative changes because it is a heavy metal from the row 6.
Right. Sir, so vanadium, I have just a question from my side
Yes, yes,
that it can be used as an remedy for an anemia. How true is
yes.
that in your clinical practice? How you
It is
experience?
very true. It is
Does it
very,
changes the hemoglobin level in the patients in the
yes.
reports? Yes.
Yes, it changes the hemoglobin level in the patient. And there are, if the patient is suffering from arteriosclerosis, hypertension, diabetes, peripheral neuropathy, and many neurological changes, vanadium can be given. And it
Okay.
is excellent remedy to
So
bring
can
up.
we use it for the children's as well?
Yes, it can be given to children also. It should be given in the low potency, around 30 you can start with. Few doses you can give and you can stop after a week and see what are the changes.
Okay. So we can expect a change in the pathological reports as well with the use
Yes,
of this therapy.
definitely. You should know such smaller remedies. It's a very much must. This will help you in your clinical practice.
Yes. One
Another thing,
important
please.
message to every viewers: please open the Boericke while you're having this session, because this will give you an insight to a Boericke. Otherwise, it would be just a lecture like you hear any other thing. But if you open the Boericke and see the remedy go sir is talking about, you will have a more approach to a Boericke, and you can use in your day-to-day practice. You can even underline the important clinical tips he has been giving you. So I request everyone, I've already posted that a Boericke should be there. Either you have an this mobile application, or you have any laptop, or you have a hard copy. I always prefer to have a hard copy with you. So if you have anything, please open it so that we can have a very interesting interaction with the sir. Yes, sir. Continue with some examples as well.
So you can give any example. I can quote from Boericke. You can give any example.
So, sir, recently the peoples are having this sudden cardiac attacks, right?
Correct.
And while going to the garbas and heavy exercise, and suddenly they
Correct.
syncope and they have a sudden cardiac arrest. So, do we have any clinical approach in the body care? We can avoid this type of attacks in our clinical practice.
Super. See, recently I had a case of 88-year-old cardiac patient, and I was called there, and the BP was almost 70/42, and the
Okay,
pulse was almost 43.
okay,
And I gave him almost Veretramal. He improved because the whole body was cold, like icy cold.
okay,
And people so much doesn't believe in homeopathy. So the patient was admitted in the hospital, and
okay,
he was diagnosed for triple vessel disease where blockage came.
right.
And the cardiac surgeon told that it is the deposition of the calcium. So I like to quote the last line of Crataegus in generality. If you open and
Yes,
you will see what is written there. Can I share screen?
yes, sir. Yes, sir. You can. Please. So you go to screen share
Yeah,
directly. Yes.
yeah. Yeah.
Yes, sir. We can see the screen now.
So are you able to see that?
Yes, sir. Yes, sir.
The last line said to have solvent power upon crustaceous and calcareous deposit in artery.
That's so
So
interesting.
is the effectiveness of the Boericke. That was the diagnosis which that cardiologist did with that old man. He said that old man was taking one banana and milk daily. So banana and milk contains lot of calcium.
Right.
And see the effect of the remedy on the arteries.
Right.
This line you have to read many times in a day. And it is a very good drug for insomnia in aortic patient. See, insomnia in aortic patient.
Okay.
You will see such patient of heart where they will not have a good amount of sleep. Nowadays, what your question was, this is called syncopic attack.
Yes.
Syncopic attack that comes, we have to rule out the pathology behind.
Okay.
Nowadays, people are not doing their blood tests regularly. For example, B12 they are not doing, D they are not doing,
Yes.
CBC they are not checking up. There are
Exactly.
many cardiac enzyme tests that has to be done even when you are less than 20 years of age. There is
Right.
one test called homocysteine, which is also
Yes.
cardiac protective this
Right.
test, where
Yes.
if you do, this will indicate your cardiac health. So
Exactly.
certain remedies like cactus, crataegus, adonis, adonis, yes. These are certain remedies that you have to remember in as an cardiac stimulant. First cardiac stimulant remedy which I use is ammonium causticum. If you open ammonium causticum,
Yes, sir.
what is written? See, if you open ammonium causticum,
Yes.
ammonium
Can I
causticum.
read for you if you
Yes,
want?
yes, please.
This is a powerful cardiac stimulant. As such, in syncope, thrombosis, hemorrhage, snake bites, chloroform necrosis may be given by inhalation. The edema and ulceration of mucous membrane produced by this powerful drug has been utilized as guiding symptom for its use, hence in membranous croup with burning in the esophagus.
See
It
the
is,
effect of this ammonium
yes,
causticum. It is powerful cardiac stimulant. If you are giving this remedy in 30 potency, it will stimulate your heart and act as such in syncope. Very nice it is written. See the application of our boric materia medica.
exactly.
Very interesting thing I like to share about, boric has less mental symptom, right?
Yes,
So I'll tell you one remedy, Spireria ulmaris. If you can open Varsha. Spireria ulmaris. Spireria ulmaris.
burning and pressure in the esophagus feels
Mhm.
contracted but not made worse by swallowing.
Correct.
Morbidly conscientious,
Correct.
irritation of the
Ach-
urinary passage influences the prostate glands, checks gleat and prostaturia, has been used for eclampsia, epilepsy, and hydrophobia, bites of mad animals, heat in various parts.
See, why I'm talking about spireria is it contains salicylic acid. It is
Right.
written in the last line, right?
Yes, salicylic acid is found in spirea.
Spireria, right?
Yes,
And this spireria has one mental symptom, that is morbid
morbidly,
conscientious.
yes.
What is conscientious? Conscientious, where the person they feels lot of guilt and remorse. No,
Okay.
our conscientious remedies are Magmure, Cyclopam, Cyclamen, then Naja. These are the remedies of conscientious. So how the Boericke writes? He writes one single mental symptom.
Right.
Another remedy I like to impress upon is moral. Uh, just open acetanilidine. Acetanilidine.
Yes, sir.
ACE.
Uh, shall I read the whole one?
Yes, you can read few
Depresses
sentences and
depresses the heart, respiration, and blood pressure, lowers the temperature, cyanosis and collapse, increased susceptibility to cold, destroys red blood corpuscles, pallor. In a head, it enlarges the sensation, fainting, moral depravity.
moral depravity. See,
Yes.
this is the mental symptom given in acetanilidine.
Okay. So
This
can
is
you
very,
explain this?
yes,
Yes.
this is the mental symptom given by Boericke. He writes just one sentence.
So can you explain the between the lines of these two words?
The moral depravity is, where the morality is lost. Matlab right and wrong is lost. Where the patient becomes liar or patient becomes or steals something, where the morality of the society is lost. This is the drug we should think on the mind part.
Right.
Mental symptoms are given also very well in Boericke, but we don't use it.
Exactly.
Another example of limitation of Boericke, I'll tell you.
Right.
Now you open carbo animals. Do you find coryza nose during eating? it is not there in Boericke. Now,
Right.
if you can open carbo animals.
Yes, I've already opened it, sir.
Yes. You go through the chapter of nose.
Nose, actually, it has been included in head part.
Uh,
Vertigo followed by nosebleed.
correct.
Nose swollen, deep bluish, small tumor on it. Feeling confused, cannot tell direction of the sound comes from.
Sound. Correct.
But that's much I have in my book.
So now the clinical importance of carbo animals is where the patient will have lot of nasal coryza while eating. This is
I-
given in Allen handbook, but not in Boericke Matramedy.
Okay.
So this is how you have to add to the Boericke or add Boericke to some other remedy. This is how you can enrich your knowledge.
Yes. Sir, I remember whatever you were telling about the mental indications in Boericke. Similarly, this seminar, even Dr. Sarkar has told the same, that Boericke has the mental symptoms, but you need to understand the between the lines of it.
Correct.
It has been included in very short lines, but you should understand how important the small remedies have this mental symptoms and can be used applicably on the clinical practice. Thank you so for enlightening this to our viewers. I would ask you now that how what are the limitations of using the Boericke? Because every book has its limitation. One you have already given that the symptom like excessive coryza during eating, which has been included in the handbook of Allen, but not included in the Boericke. What else is the very limited limitations of a Boericke which we have are been lacking while using the Boericke?
Very true. See, every book has its own limitation, no? So if we see certain symptoms are given in Pulford, which is not given in Boericke also. So there are many symptoms that we can read from Pulford or Pierce plain talks. To make your Boericke as a complete, make Boericke as a center Boericke, as a center line. And then you have to move with a different mathematics and go on adding everything to your body. One day the book will be complete. As the every person is not complete, even Boericke is also not complete. So
Right.
that is limitations of Boericke are also there because many mental symptoms are not given. But if you read Kalimur, mind, wonderfully it is given, but it is given in short. If you can open Kalimur.
Yes, sir.
Varsha.
Yes, sir. Just a minute. What part you want me to
Just the mind, if you read mind.
mind? Kalimur mind has not been given in Boericke.
It is head, it would be in head, I think.
Imagines he must starve.
Yes, imagine he must starve. Imagine he must starve. This is the mind symptom, but given in head, I think, no?
Yes, sir.
This is the so the Boericke was not systematically revised on the part or like an no Kant's Materia Medica, where everything was given in a systematic way. So this may be the limitation, but we have to read between the lines. To
Yes.
support Boericke, we should read one another author is Blackwood. Blackwood Materia Medica. And another is Burt. Burt, Blackwood, and Boericke. Three B's we have to read together. Then only the Boericke will be complete. And
Yes.
very interesting thing that Varsha I like to enlighten is the bulimia better by drinking, which I have cured one patient where she said, no, there is lot of craving and eating for many things. But if I drink, I feel better. You can read that Kalimur part.
Just a minute, sir. Fatty or rich food causes indigestion, vomiting of white opaque mucus, water gathers in the mouth, pain in the stomach with constipation. Bulimia, hunger disappears by drinking the water. Last
Very
line is stomach part.
correct. So what is bulimia is also a mind symptom, no?
Yes.
Yes, this is how we have to read between the lines. Bulimia, hunger disappeared by drinking water. This is wonderful symptom of Kalimur. Kalimur is a polycrest remedy, but we are not using it.
Exactly.
I have used several times in worm cases, pile cases. Piles are wonderfully treated with this Kalimuratic.
Yes.
Now please open muriatic acid. What is given? Mouth and anus chiefly affected. First few generalities, muriatic acid.
Yes, sir. This acid has an elective affinity for the blood, producing
Blood.
septic condition similar to that found in the low fever with high temperature and great prostrations. Patient becomes so weak, she slides down the bed, decomposition of fluids, involuntary stool while passing the urine, hemorrhages, mouth and anus chiefly affected.
Mouth and anus chiefly affected. That is very important of muriatic acid. Mouth is the ulcer and the anus pathology or the pathology of a piles. If a patient comes with a ulcer and the hemorrhoid bleeding, we should think about muriatic acid and lot of the acid symptomatology. And there is lot of moaning that we see in muriatic acid.
Yes. Okay.
For example, do
Yes, sir.
another example, if we can read from Amon Mute. If you can open mind of Amon Mute,
Yes, melancholy, apprehensive, like from the internal grief, desire to cry but cannot, consequences of grief.
desire to cry and cannot. There is one word given in Hahnemann's Materia Medica Pura, that is lugubrious, which sir told recently also, and I have read several times. That is lugubrious. If you open Oxford Dictionary, which gives you the exact meaning of Amon Mure. So Amon Mure we are also missing as a polycrest remedy. Tremendous, tremendous understanding of Amon Mure. Excellent remedy for sciatica. Excellent remedy for stomach ailments. Excellent remedies in many, many cases of silent grief where ignitia is indicated. We are
Right.
giving ignitia and we are not using Amon Mure.
Yes.
And very interesting cough associated with liver affections. Please, 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 this is a very interesting remedy.
Yes.
And desire to cry but cannot. See the ignitia symptom and consequence of grief. This we have to support with while reading Allen Handbook.
Okay.
Allen Handbook will give you the clarity of the mental symptoms given by Boericke. So Boericke has to be supported by Allen Handbook.
Right. So we have 4 books now: Blackwood, then Bird, then
But
Boericke, and Allen Keynote, right?
Allen's
I've already mentioned the name of the books on the comment box. Please go through it so that you can even mark it if you want to purchase the books together. Yes, sir. Continue.
see if a patient tells you, and if he's a woman, no, and she will tell you, can you cure your cataract? The drug would be Sapia. If you open Sapia, we'll get. Now open Sapia. Sapia we don't use in cataract.
Yes,
Calcarea floor we use. We
exactly.
use silica, but Sapia we are not using.
Yes.
You use Sapia and you will get good result. And it is written also.
Muscular asthenopia, black spots in the field of the vision, asthenic inflammation, and in connection with the uterine trouble, aggravation of eye troubles, morning and evening, tarsal tumor, ptosis, ciliary irritations, venous congestion of the fundus.
It is good remedy for cataract in women. I think it is in the generalities also. It is a woman remedy.
Yes.
I don't remember where it is written, but it may be in female symptom also. Just you can find cataract. It is given in Fatak. Sorry.
Okay.
This
Okay.
is the role of, this can be a limitation of a Boericke.
Boericke. Right.
I'll show it in, if you
Another
want, I can
book,
show it in Fatak.
another
Varsha.
book which you have to read is Fatak as well. And I would definitely point it out. Fatak is very, very precise clinical book along with the Boericke. You must read in for practice.
Can you see? Can you
Yes,
see?
sir. Yes, sir.
Arrest cataract
Cataract
in woman.
Right.
It is given in Fatak.
Right.
Arrest cataract in woman. My God, see the importance of this, clinical importance of Fatak, materia medica. And it is a limitation of Boericke again.
Yes.
So we have to combine many books and you have to add into the Boericke also. Many
Exactly.
sepia cases can be cured of cataract with the sepia. Sepia as a drug, a constitutional drug.
Exactly.
बहुत
Sir,
इंटरेस्टिंग बात और बोलता हूँ, the children of sepia has open frontal eyes.
that we usually see in the Calcarea group.
Yeah, but it is also given in sepia. See, with open frontal children. दिखाई दिया
Exactly.
आपको?
Yes.
It is also given in Boericke also. If you go to Boericke, it is also written. Boericke, sepia, ST, sepia,
Open frontale.
open frontal, sepia, frontal. Oh,
In third or fourth line of the head part, sir.
yes, open frontal. Roots of hair sensitive. देखा आपने?
Yes.
And roots of hair sensitive is urundo also. Urundo.
Yes.
This urundo drug, we are not using it. I can show you the application of urundo also. Okay, you can ask any other question.
Okay. Sir, students are usually confused because there are multiple symptoms inside each remedy of the Boericke, and they're very precisely being given in the Boericke sentences. Like you have said, whole mental has been given in 1 or 2 words. How to memorize the Boericke Matra Medica? This is a very big question from every practitioners because they want to read, but they could not memorize it properly. So can you give some tips and tricks to memorize the Boericke?
The tip of the trade is, tip of a trade is that one should not memorize.
Yes.
If you try to memorize, you will get lot of failures. You have to learn in the way of speed of action, what is the remedy made from, what is the source, who was the prover, what is the story behind it. I can tell you the story of Actius Pipita, where Jesus Christ was taken by his apostles in the hand. इतना वजन था जीसस क्राइस्ट का, वो जैसे उठाया उसका कमर दर्द होने लगा. So that is the story behind Actius Pipita. So it is a drug for rheumatism of the small joints. The story and the application. You can learn Boericke by story also. There are many flowers that is being used, has the history also. For example, Aristolochia clematis, which looks like a uterus. Aristo matlab to stop the lochia. And it is a drug for CKD also, kidney failure drug.
Okay.
But we don't use Aristolochia in kidney failures. And
Exactly.
the word like antimony. Antimony has come from the monk, where antimony was given to the monk and there was death in the monks.
Oh.
So from that, the name came antimonium, the monk. the monk, the bhikshu monk, Buddhist monks were given this antimony powder. And after giving this antimony powder, there was death. And from that, the antimony name came.
Okay.
And this Sapia officinalis, there was two proving, Sapia succus and Sapia officinalis.
Right.
So there was confusion between herring and honeyman. There was a lot of confusion, which was a good proving done by honeyman. So honeyman, those the people around the honeyman said that this proving is incomplete. So honeyman said, okay, you start prove this Sapia, and the proving came to be the same. From that, the officinally word was added. Sapia officinalis. But
Right.
officially, this is the name. How the name originated? If you read Clinical and Clinical Materia by Farrington, excellent chapter of lachesis. Suriname, the Dr. Henning went to Suriname. Even the smoke which came from the proving of the Surukuku snake, he was almost sinking or dying. And he told his wife to write down all the symptoms. This was the story of Suriname, the most dangerous snake, poisonous snake at the Suriname. For
Okay.
that, you have to read books, need not to memorize anything. Go on reading, adding, reading, adding, and use as a practical experience.
Right.
The day will come that you will be a champion of Boericke.
Right. Sir, can you give some examples of the cases, short cases in your clinical practice, and you have precisely used only the Boericke and you have got excellent results out of it?
Okay. First example, if you open syphilis, if you can open syphilis, the first line which is given is utter prostration in the morning. See if it is written or not.
Pardon, sir, what symptoms I have to?
Utter prostration. The word utter is written.
Utter prostration and debility in the morning.
Yes, utter
First,
prostration and debility in the morning. The first sentence which Boericke writes, if you have such kind of patient where there is utter prostration and debility in the morning, think also of syphilis and the heel pain. Heel pain, especially the tendo-HLS pain, the bone pain. Bony pains are favorite pains of syphilis. If you correlate both the things, the remedy is syphilis and the linear cut or the center cut of the tongue.
right.
This is more than enough to prescribe syphilis and
Right.
aggravation at night time.
Exactly.
I would like to tell you about one thing which is very important is the role of antimiasmatic. Without antimiasmatic, you can't treat many of the cases. You should know the role of smaller remedies. You should know the role of mother tinctures. You should know the role of triturations. You should know the role of sarcodes. You should know roles of nosodes. Very, very important. If you open Allium sativa, Varsha, if you can
Yes,
open
sir.
Allium, generally it is last two lines, 35 to 40 minutes. Atrial hypotension, 35 to 40 minutes, 25 to 40 drops, Allium sativa. 35 to 40 मिनट्स ऐसा कुछ लिखा है.
Third to sixth potency in tuberculosis doses 4 to 6 gram in moderate state of desiccation daily in divided doses.
If you can read, एक मिनट, ड्रॉप डोजेस देखो ना.
एलियम सटाइवा में नहीं है सर.
It will reduce the arterial hypotension.
एलियम सटाइवा.
हाँ, एलियम sativa देखो ना अच्छी एक तरह से.
It is
Ah,
written in the generality. Arterial hypertension begins usually in 30 to 45 minutes.
30 to
After
45
20
minutes.
to 40 drops doses of
Yes, that's what I was telling. Vasodilatory properties, arterial hypertension begins usually in 30 to 45 minutes. My God, what that person is writing. See the importance of the Boericke. 30 to 45 minutes after 20 to 40 drops of the tincture. My God. Now open scutal area. The last line of scutal area. Scutal area.
This is a nervous sedative where nervous fear predominates, cardiac irritability, chorea, nervous irritation and spasm of children during dentition, twitching of
Varsha in head chapter.
head chapter, dull.
Last line.
Last line is yes. Nervous sick headache, worse noise, or order light,
Light.
better night rest, and 5 drops of tincture.
5 drops of tincture. Very, very important. If you give this 5 drops of tincture in nervous sick headache, there will long lasting relief to the patient. And it is a remedy for migraine, especially on the right side, the right hand side. This is important again. There are many such examples. Do you know the drug of angina pectoris given in Boericke?
Please tell us, sir.
The drug for angina pectoris given in Boericke is Bryony. If you open Bryonia, angina pectoris used in tincture. See the role of mother tinctures. In respiratory, it is given last line. Angina pectoris use tincture. So the role of mother tinctures are also being given in our Boericke materia medica. Do you know which remedy completes the action of lachesis? The remedy is Crotellus cascavelis. That completes the role. When you are giving lachesis, this Crotellus cascavelis will complete the role. So we'll open lachesis. Relationship. Crotellus cascavelis often completes the curative work of lachesis by Muir, the student of Hahnemann.
Right.
Anything else, Varsha?
Yes, sir.
Can you tell me the drug which is better by closing the eyes? Headache better by closing, has to compel to close the eyes. The drug is aloisocotrine. This is polycat drugs that we are not using in our practice.
Right.
Okay.
So, can you give us some examples of a very rare remedies which are only given in the Boericke and is a very useful applications in clinical practice?
First remedy is
Yes.
First remedy is Lobelia irenaeus.
Yes.
It is a good drug for cancer of omentum. And second drug is, I'll tell you, Solanum, Scrophularium. This has the affinity for the testicular carcinoma.
सोलेनियम
स्पोरोडियम, सोलेडियम स्पोरोडियम करके एक दवा है।
सर कहाँ दी है, कौन सी रेमेडी के रिलेशनशिप में दिया
हाँ,
है?
मैं बताता हूँ। Another drug is Levico, wonderful remedy. Another drug is Matico. These are the drug one should use. Another drug is rosmarinus. Rosmarinus is a drug. There are 3 drugs where chronic hair falling is stopped instantly. 3 drugs. Varsha,
Yes,
radium brome, rosmarinus and visbardum. अगर आपके बाल उतर रहे हैं और स्ट्रांग नहीं हो रहे हैं, 3 दवा पे आप जरूर बैट करना. फर्स्ट इज रेडियम ब्रोम, सेकेंड इज रोजमेरिनस एंड थर्ड इज विस्बार्डम.
Visbadam I use, sir. Can you explain where these two remedies, the indications have been given in Boericke?
Okay.
If you can.
It is given in Boericke only.
Yes,
Visbardum is a drug where the patient will tell you, I want the growth. मुझे growth चाहिए.
I use for that.
Correct. And
Yes.
second, अगर patient ऐसा बोले मेरे split ends है,
Right.
और अगर patient ऐसा बोले कि मुझे गूंच हो जाती है, tangles,
Hmm.
the remedy is borax.
Right.
And second drug is sorinum.
So right now.
Hmm.
So the other two remedies you have said.
Radium brome has its own chronic pathology behind. Chronic pathology related to too much drugging. Second, there is X-ray exposure that is being done. Third, radium brome is a drug where the patient is given CTRT in the
Yes.
cancer cases where the hair falling is being
Too much.
it is too much.
Yes.
Another remedy which comes into my mind is Eclipta alba. Eclipta alba, which is very near, that comes with radium brome. Eclipta alba is Bringraj. Unfortunately, these Indian drugs are not being used properly. Nowadays, patient comes with like hyperlipidemia. The drug is Glyceria glabra. It is excellent drug for hyperlipidemia. You will get result with Glyceria glabra. I can also bet. Another drug which peripheral neuritis with sole tenderness, or the patient will tell you as if I am walking on cotton or soft thing. That is the remedy is glycerinum. These are the smaller remedy. Another drug for peripheral neuritis is carbonium sulf. The last line of carbonium sulf in generality, if you read, it is given there.
Just a minute, sir. Peripheral neuritis.
Yes, peripheral neuritis. You know, there is one drug in mental symptom, walks in circles. Or if you do garba in a circle, it is tuja. So those who are doing this garba, they have this psychotic tendency. Think about tuja also. This is how I apply in my practice.
Okay.
If you open Kent, no, walks in circle. मैं यहाँ निकालता हूँ. Yes, I'll show you. We are moving away from Boericke, but I would like to show that.
That's not a problem, sir.
It is given in Fatak. Walks in circle in room. And this is a drug for ADHD also. Another drug for ADHD is chlorpromazine, which is given in Julian. Very well it is given. 131 Therapeutics of Materia Medica by O.A. Julian. This book you can add. Wonderful book it is. Varsha.
O.A. Julian on this. I should add in the list I have written.
Yes, list you can add. OA Julian. Walks in circle in room. See, it can be room or it can be in a Garba ground. The Tuja is also the remedy. Psychotic. Obsessive compulsive neurosis. There is lot of obsession. In essential, there is rubric called automatism. So there are many rubrics. No, you can learn homeopathic like anything. This is non-ending topic. Homeopathy is add to the infinity. Infinity, you can go on and on and on. Newer drugs we should know. We should know smaller drugs. We should know mother tincture. We should know everything. But
Yes,
need not to memorize. Put it into your practice. Practice makes man perfect.
exactly.
Daily. If you can ask Pandit Ravi Shankar at the age of 80s, he may be doing sitar vadan or santur vadan. Daily
Everything.
he practices.
Exactly.
So if you don't practice, practice will not happen.
Exactly.
Patient will tell you, but drug will not click in your mind.
Exactly.
You may read 10,000 remedies, but this should click in your mind. Mind should ready to grasp certain things.
Exactly. Very
Any
true.
other
Very
question?
true. Yes, sir. Sir, in the Boericke, every remedy, at the end of the every remedy, Boericke
Correct.
has included some indications like its potency and its
Correct.
reputations, and even some indications like how we can we use. I have read in some of the
Correct.
remedies, external application has been given and all that. How useful it is for the clinical practice as per your experience? And should the student should follow the same potencies or they should improvise as per the generation?
See, the availability, if you can open acetic acid, 1x is being given to soften the fibrinous exudate. Excellent remedy to dissolve the fibrinous exudate has been given by Boericke in 1x potency in acetic acid,
Yes,
right? So if 1x is not available, you can start with 3, you can start with 6, you can start with 12. That doesn't matter. But
right.
if you are giving what author has given, just try to see what happens. This all the part of practical experience. When someone is saying after many years of practice, he may have done something right. Right?
Ex-
So one should give and see what is the changes. I can tell you 10M, 50M, CM are the remedies or rather potencies very effective in hair fall. You need to go more than 1M.
Okay,
For example, hair falling in puja cases, less than 50M it will not work. So there are cases where we have to give 50M, we have to give CM. For that you have to read Kent's Materia Medica tuberculin.
right,
We have less time, or I would have shown you what Kent has given, ascending potencies. From tuberculum, he says you have to give 10M, 50M, CM, starting from 30, 200, 1M, 10M, 50M, and CM, ascending potencies.
but this ascending potency shall be subsequently given on the first prescription, or as per the requirement of the patient it should be ascended.
Very good. It should be given according to the susceptibility of the patient, immunity of the patient should be judged, and it is all discretion upon you. In
Right.
what area you are saying, कौन से एरिया में आप रहते हो, कौन से सिचुएशन में हो आप, उसके ऊपर से आप जज करो. You last judge is your own thinking power. You have to judge in your own way. Tuberculum should be given in higher potencies only. If you want, you can open Kent's Materia Medica tuberculum chapter. You will get the answer. What he has
Right.
done, it indicates the tendency for adenoid tonsils. My God, what an authority! If you want, I can show you in my software.
Yes, yes, sir. Please.
Yeah. Yeah. Are you able to see?
Yes, sir.
If
Tuberculosis,
tuberculum boenum is given in 10 m, 50 m, cm, 2 doses of each potency at long interval, all children and young people who have inherited tuberculosis may be immune from their inheritance and their resilience will be restored. It cures most cases of adenoid and tubercular glands of the neck. My God, what an authority which is giving. It solves all the question about potency.
right.
My God, the Kent which has given. So for that you have to read whole tuberculinum from Kent's Materia.
Today's homework for everyone.
Please you should read.
Yes.
That is the answer to your question. With practical example from the books. There is one example I can remember of an Dalkamara
Yes, sir.
from Allen's Encyclopedia, where he writes impaired genus eczema, which means pustular eczema better treated with Dalkamara. If you can open, see. I think it is in Bot. Bot. Dalkamara. See, my principal remedy for impaired genus eczema of scrofulous people is Dalkamara. Varsha,
Yes, sir.
exact line. Impaired
Exactly.
genus eczema of scrofulous people in Dalkamara, given by Burt. Need
Yes.
not to memorize. It came into my mind within fraction of seconds.
Yes.
Given by Joseph, Joussct. This is the role of Dalkamara. You have to find 26 cold word written in Boericke.
Today's
That is also homework.
second homework.
Second homework.
Please mark that cold word and take a shot of it, post on the Instagram and tag me and sir on it so that we can understand how you utilize today's lecture and how much you have understood the importance of it. And sir, from this 26 words, what you are telling, I remember Dr. Sarkar's words in recent seminar. He was saying the same, that the more the word has been repeated in a drug, the
Correct.
important core theme of that drug is that
Correct.
word. So you should see, the more the author has repeated the same thing frequently,
Correct.
you should remember that symptom. That is the core theme of that drug. So that is the pointer I have taken from that seminar. So I think this is very correlated what you have spoken today.
Correct.
Sir, can I ask one last question with you?
Please.
How you remembered the Boericke? It has been 25 years. I know you were telling that I have not remembered, I've understood, and I'm using it daily, I'm reading it daily. But any pointers we as a newcomers and early practitioners should understand, that how a Boericke should be read and memorized?
First important is you have to open your hard book daily. 10
Exactly.
to 20,000 times you have to read. Go on reading and recall. We don't recall things. That's the problem with our homeopathic doctors.
Yes.
Physical book has to be open. At the midnight you can open, you can read when you are at a leisure time. You can recall when you are standing in a bus stop. When you are eating also you can read. You can rather recall.
Yes.
Recalling is very important. Even encyclopedia reading is also very easy.
Yes.
Even Materia Medica Pura is also easy. How to read Materia Medica Pura is one technique I can show you.
Yes.
At what hour of the proving or the prover has got this symptom? At the first hour, second hour, after 2 days, 3 days, 5 days, 6 days, 7 days. You have to underline this pura. In
Right.
materia medica pura, you have to underline at what time of the proving the prover has got this symptom, the chronological evolution of the symptom. This is
Right.
very important to understand. If you don't understand this phenomena which is running in Boericke and many other books, it would be very difficult.
Right.
You have to support Boericke with many other books. Then only the Boericke can be understood well. For example, if you read Bird and Blackwood with Boericke, you will understand excellently understand the meaning of Boericke mathematics. Then you have to serve the internet also. What is giving extra information that is being given. Even you should take a help of a Mikhail Yakir Wonderful Order Plants book, Mikhail Yakir book. It is very good book where you can know many plant kingdom remedies. Do you know carbohydrate is also a plant remedy? So Hahnemann proved this carbohydrate from a plant, or rather it is a tree, which Mikhail Yakir gives. You have to know all the stories. You have to know all how the things was evolved. You have to read Farrington Clinical Materia Medica. And another book is Copperware. Copperware. Materia Medica and Therapeutic by Copperware. Excellent book. And another book is of George Royal. George Royal will give you the application of many drugs, even Pulford and Pierce Painter. Need not to remember anything, need not to memorize. Go on reading, and make a note where it is being written. For example, which I have showed you about the cold. Word cold is 26 times given in Boericke mathematics. There are many, in cactus, constriction is given almost 12, 13 times. There are certain words which have been used by the author. So this is the core of the, or rather the pattern of the remedies.
Right.
So the pattern of the remedy has to match with the pattern of the patient. And that is called similia similibus current. That is the individualization that we do in homeopathy. What is individualization? We have to individualize each case in a neat, clear manner in the pattern of location, sensation, concomitant, and modality. Causation is at the top. Causation and type. And then you have to read the Kent's Materia Medica. Kent Materia Medica along with Boericke and N.M. Chaudhary book. These were we were reading when there was no software available. Software is just our support. Need not to have any kind of books. It comes into your mind when you are reading in a clear mind. What will help is your sound senses, fidelity in tracing the true picture of the disease. What the Hahnemann says, right? Hahnemann organ on aphorism has to be also read clearly. Daily we have to read one aphorism. Aphorism will make your soul very clear. Another way of remembering is Jyotish Shastra also. This is another topic which I am working. Or the grahas. The plumber mate is from the Saturn personality. Budh grah is also certain remedies have this Budh grah. Certain has the Chandra, that is moon. Vacillating. Vacillating is the word used in crocus. Fickleness, the word is used in Asafoetida. If you can open Asafoetida, you can see fickleness, fickle-minded. If you can open Asafoetida. See the word fickle. Are you able to see fickle?
Yes, fickle
Fickle
cannot
cannot perceive in anything.
anything.
This is the essence of asafoetida. One word is enough to understand the drug.
Yes.
And if we correlate with Phatak's materia medica magnifies her symptoms. You have to read Phatak materia medica or rather Phatak repertory. Exaggerate her symptom. If you want, I can show you that also. See what is the Phatak. Phatak repertory. Exaggerate.
So go to the search bar directly. Click.
Exaggerate. See? Exaggerate. Motion exaggerate. Exaggeration of a mind symptom. asafoetida is there. ये ना सॉफ्टवेयर स्लो होते हैं हमारा दिमाग फास्ट चलता है उससे दैट इज द प्रॉब्लम विद exaggeration is chamomilla ignitia and asafoetida you can add nux moscata there that's the problem with software हाँ वर्षा asafoetida chamomilla and plum balm
Yes.
asafoetida see the mind symptom where asafoetida will exaggerate and magnifies her symptom. This is the hysterical part of asafoetida from umbelliferi. The umbel. Now the umbelliferi is called APAC. It is the essence of APAC family. It is syphilitic drug, according to Sankaran's theory.
Right.
Okay. Anything else?
So very interesting session from your side. I think we have completed the broad spectrum of Boericke today, and we have talked too much about the clinical uses of it. And if and only if the viewers are very interested to learn more about Boericke, we can come again with the same topic. But if you allow, I want to take some questions and comments from the comment box of today's viewer.
Please. No problem.
Yes. So Umesh Kumar is telling good morning, ma'am. So good morning. And now it's a good afternoon. And Dr. D.N. Prajapati is telling good morning, Dr. Varsha and Dr. Speaker. So good morning from our side. Raj Patel, hello and good morning, Rajiv sir. Umesh Kumar, medicine type, ma'am. I don't know what question he has asked. Please, medicine type every, ma'am. I don't know, Umesh Kumar, if you can elaborate your question, we can understand better what you want to ask about the medicines. Nanuku Nayak Katravatu is telling, good morning, sir and ma'am. Can we give the vanadium for anemia in pregnancy?
When it is indicated, you can give.
Umesh Kumar, alcoholic people, any mother tinctures, dilutions most experienced, sir?
Angelica.
And how to utilize it?
In mother tincture, you can start.
Any particular doses?
10 drops 3 times in a day.
Okay.
For at least 1 week.
Okay. Umesh Kumar is asking, Yohembinum medicines experience, sir?
Yohembinum is experiments in insomnia where the patient will have past events in his life. If the patient tells you, I have insomnia because of some bad events that has been occurred in my past life, UM is a drug of choice. It is a drug for menorrhagia also. It is a drug for impotency, psychological impotency also. It is excellent drug.
Right. Again, Umesh Kumar, small remedies, how can we use it?
Small remedies can be used for certain period of time, then you can stop. For 1 week, you can give in 30 potency, and you have to stop and see what is the effect. You can even give for 2 days also. You can even give for 3, 4 days. You can stop. You can give even for 1 week and then stop. Not more than 1 week.
So how long we have to wait for its effect?
You can wait for another 1 week and see what is the difference.
Exactly. Pradeep Kumar sir is asking, good afternoon, Rajiv sir and Varsha ma'am. So good afternoon, sir. And I highly recommend, please come to my channel. And actually, I'm very, I want you to also be the part of this channel. Hiral Mangukia is asking for Glycerigia glabra for hyperlipidemia, mother tinctures, or which potency?
It is in Q power, mother tincture.
How
Mother
many
tincture
grams?
can be
How
given
to-
for 15 days, 2 times in a day, in half cup of water, little lukewarm water, 10 to 15 drops for at least 15 days, and wait and watch.
Sir, the how after how many how much time we have to repeat the cholesterol levels and all in the
Cholesterol level can be repeated for therapeutic point of view for 1.5 month after and see what are the changes.
Okay.
Then you have to restart the mother tincture. You have to stop for 15 days. Again, you should start for 15 days.
15, then gap, then
15,
15.
yes,
Yeah.
yes.
Okay, okay. Any other medicines as a constitution we have to add, or we can stick to this
No,
mother?
when you are giving pure indication of mother tinctures, you can give only for mother tinctures.
Okay.
No other indication should be given.
Okay. Nanaku Nayak Katravatu is asking, sir, please discuss about the usage of anti-miasmatic remedies during pregnancy to remove the miasmatic dyscrasias in newborns. Is it possible or not?
Yeah, it is possible. Soranum is first drug that you should give when there is continuous vomiting. Second drug is Madorel. You have to read Kent's Materia.
Red Snow Goon, is MacRepertory the best software? So I'm sorry to say this, but we don't recommend from our side the best and the worst. Every repertory has its own scope and
Your
limitation.
repertory is best repertory.
Whatever you understand the best and you are more used to it, you can go for it. If you want to understand the repertory part, please approach to the particular person of that repertory. For example, for the homeopath or radar or kara or whatever back repertory and all, just see the utilization, what is actually matching to your requirements and how easy that repertory is for you, and then select your repertory. So don't rely on my word or Rajiv sir's word or any other speaker's word. The person who is more oriented to that repertory, that is most useful, I think so, sir. So from our side, we are not going to recommend anything, but still, you can search out for the best repertory for your use. Dr. Pradeep sir is asking, Rajiv sir, which case will demand using Boericke repertory the most as per your experience?
When the mental symptoms are fever, you can use Boericke.
Vishakha Belwarkar is asking, Glycericia glabra for reducing the lipid is to be used in mother tinctures or in potentized form.
Mother tinctures more.
More usage. Okay. Pradeep sir is asking, I will request Rajiv Bhai to show his Boericke snap. Then and then you can understand how many times he has highlighted on each page. Sir, this is the very demanded question. I would ask you to please stop your screen sharing and show your book. I remember my teacher was telling us in the first year of BHMS, the more your book is not organized and जितना ज्यादा फटा हुआ आपका बुक का पेजेस होगा ना, I would understand कि आपने उतनी बार उसको पढ़ा है. So if you want to see sir's book, still he's adding daily the newer points to it. Can you see how much he has highlighted? Can you share other pages as well, sir? See, You need that dedication to Boericke. See, Boericke is like, it's a Bhagavad Gita for you. Daily you should read. I've heard talking Dr. Sarkar sir about it. He still reads every day. At the age of 70, he is daily reading the Boericke 2 hours to enhance. उन्होंने कितनी बार पढ़ी होगी किसी को नहीं पता है. He remembers each word and each line of every drug, and still daily he read it. And we don't read at this age of our life daily. तो आप ये मत कंप्लेन कीजिए होम्योपैथिक वर्क नहीं करती, होम्योपैथिक ये है, होम्योपैथिक वो है. हमने कितनी मेहनत की है उसको समझने के लिए, वो हम खुद ही जानते हैं. सो जो सक्सेसफुल रिजल्ट्स दे रहे हैं उन्होंने कितनी मेहनत की है. आप यू कैन सी दैट स्नैप, राइट? Thank you, Pradeep sir, for this this demand, because even I wanted कि सर अपनी बुक दिखाएं बच्चों को. Sheikh Saad, please keep another session. We'll definitely going to plan something due to Diwali. I'm not going to do it recently, but definitely we are going to plan a very other sessions from sir. Dr. Babita Dhanuka, thank you for attending the seminar, ma'am. Not getting the plumbum for biscuit reference, please mention it.
Yeah, it is in the Patak repertory.
Okay. The something Dhurisham integrated med talk. Please suggest the medicine is sleep disorder and how to manage them from the Boericke.
See, first, which I have told you, the cretaceous insomnia and aortic person. Then, if the patient is in surgery, the remedy is Ticta pulmonaris. And if the patient has lot many thoughts during the night time, Coffea is one of the drugs.
Yes.
Second drug is Passiflora.
Yes.
In mother tincture, it works wonderfully.
Yes.
But Passiflora has its own depressive symptom also. Even if you prescribe Raufia serpentina, it sometimes works in depression as well as insomnia as well as in hypertension.
Yes.
These are the three indications of Raufia serpentina. But Raufia serpentina patients are in severe depression.
Right.
OCD patients.
Right.
Sarpagandha it is in Ayurveda.
Yes.
So depending on the particular selection, we can use such insomnia drugs.
Right.
Venom is also one of them.
Yes. Sagar Tiwari is asking for axillary armpit fat. Which remedy can be thought of?
Axillary armpit, the affinity goes towards Asteris rubens and Varieta and Buffo.
The Risham integrated med talk also suggests the Boericke medicine is zero testosterone in a patient. So azoospermia.
Azoospermia is X-ray. X-ray and syphilis.
Okay. Pradeep sir, Google and Oriander are also good mother tinctures for dyslipidemia. 5 drops 2 times for 3 months.
Yes.
Repeat profile after 3 months. Thank you, sir, for this suggestion. Still, I'm asking you to come to my channel. I really wanted you to be there. Dr. Premlata Roti, sir, in patients with tinea, where severe itching and patient complains, which remedy can be thought of?
Sempervinum tectorum in mother tincture, you can start with. And second is tellurium. And third is eagle folia also you can give. And Cassia alata. Cassia alata. And if it in the region of coccyx, you should start with Bovista, and another drug is ammonium carb. If you read from Boericke Metromedic.
Okay.
Between the legs and the genital area, that is also being covered by ammonium carb and ambragrisa and croton tip.
Okay. Dr. Premlata, okay. Patel Hersil plus, sir, ma'am, I am in a second year. How to study the remedies with understanding every symptoms, pathological and mental as well.
You have to read slowly everything. You have to read your basic books, you can start with Kent's Materia Medica. From Kent's Materia Medica, you can jump to Boericke, you can read Allen as well as in many other books. I think you should start read Herring Guiding Symptom also and
Yes.
Allen's Encyclopedia. There are all these two books are very boring, but you should make things easy for you to read. You can start writing the italics of the books. Clinically verified symptom. I have already written whole Boericke italics. Whole Boericke. All italics of Boericke.
Okay. Dr. Bhavesh Shah is asking, hello, good afternoon. Can you please share your experience in cases of ringworm?
Ringworm is a topic of constitutional remedy. You can start with Cassia alata, Sempervinum tectorum, and Calcarea carbs works wonderful. Then Tellurium, then Sapia. Sapia will work in alum potency in ringworm cases. And if it is in the genital area, you should think also of ambra and ammonium carb. And scrotal area is crotontic.
Okay. Just a minute. Umesh Kumar is mentioning it's a Gita. Boericke is a Gita. Okay. Pradeep sir, unable to see on YouTube Rajiv sir Boericke's book. So can you please again show the Boericke?
Yeah, sure. It is visible?
Let me see, sir. Just a minute. Let me check. Usually it takes 10 to 15 seconds to appear in YouTube Live. Yes, it's visible. Thank you, Pradeep sir, for enlightening this. Dr. Anjana Dongre is asking, good afternoon, Dr. Varsha and Dr. Karia. Wonderful session. Keep it up. Thank you so much. And Umesh Kumar is asking, X-ray which potency, sir, in azoospermia?
You can start with 30.
Repetitions? Any
Repetition, you can go for 1 week or you can go for 3-4 days, depending on the susceptibility of the patient.
Right. So here is the end of the questions. We have taken too much questions from viewers' side. And thank you all the viewers who have attended today on the Sunday morning. And I think you have learned a lot of things from today's session, how to utilize the Boericke. It was my demanded topic from the sir that people should understand this small booklet has a too much utilization in clinical practice, and people should read this daily. Sir, any message for the upcoming students and practitioners of homeopathy from your side?
First of all, they should attend lectures in the college. And second, when they go home, they have to revise what they have learned today. I have seen students spending more time on social medias.
Yes.
Rather spending more time on social media, you spend time reading books.
Right.
Reading books are very mandatory.
Yes.
I can show you my library, which is on my left-hand side, full of books. Same books are there in my house also.
Right.
So there is no shortcut to success. You have to struggle, and struggle. One day, Sachin Tendulkar was asked how you are known as a god of cricket. So Sachin Tendulkar said, consistent and persistent. So if you are consistent and persistent in your hard work, one day you will be the champion of this world.
Yes.
Nobody will restrict you to become a champion. No one.
There is no short
time. Tough time never lasts, but tough people last. This is the book you should read.
Yes.
And Power of Subconscious Mind by Murray, Joseph Murray.
Yes. It's a wonderful book. Yes. And lastly, we take small, good afternoon, sir. Spelling of Angelica.
Angelica.
And
Angelica has a power to soften the warts also.
okay.
like
And
silica.
one more question, last question, Deepak Kumar Yadav. How to manage the psoriasis?
You have to manage with a clinical point of view. The drug you should remember is natromars, thyroidinum, calcarears, and manganum aceticum, which people are not using it. Manganum aceticum is a drug of choice.
I have used this Manganum aceticum in one of the case of ringworm, and I got wonderful result out of it.
Very good. And another drug for psoriasis is calibrum.
Yes.
Calibrum we should use.
Even Kali Sulf has a very wonderful
Yes,
response to
alisulfate is also
psoriasis.
wonderful with a
Yes.
psychotic manifestation.
These are very small remedies. I think peoples are not reading the small remedies very frequently, and that is the limitations to your practice, because you are only focusing on the mind part. You are only focusing on one particular way of practice, and you are not focusing on the broad spectrum of the drug. I remember the Sarkar sir's word in this seminar, and he told, only remember, you read 10 remedy. You only remember 10 remedy, but 10 remedy, that 10 remedy should be known on all the perspective. So if you only remember 10 remedies, still you can manage your clinics. But the problem is that we read thousands of remedies, but we don't know anything about it. So
One thing,
this is, I think, was the pointer from his seminar. जो याद आ रहा है वो मैं शेयर कर रही हूँ viewers के साथ, because I don't know. We should learn from this legendary persons like you and sir, that how every day there's a struggle to a reading, and I don't know how people manages without the book in their clinics. Even I have an habit. I will show my book, but I don't mark it, but I write every pointers which I learned from the seminars, and I point it at the side of the drug with the pencils, and I utilize in my practice. Like if I find something very interesting with your teaching, I will write it at the side of the book. Okay, this is the pointer to the remedy, and we should know it. So every person, every homeopath who are practicing since many years, they have a great way of practicing, learning the drugs. And I especially learns a lot when I take this YouTube lives. I don't know why. That improvises my knowledge, but I love to share these things to my viewers also. Sir,
one thing I would like to add,
yes, yes.
this thyroidinum, lac defloratum, arnica, these are as symmetrical presentation. एक इरप्शन एक हाथ में हुआ है, दूसरा सेम उसी हाथ
Same
में हुआ.
होगा.
अगर सोरियासिस अगर आपको ऐसा मिले, think also of arnica, lac defloratum, syphilinum,
Yes.
and kali iodine
Kali
and
iodine.
thyroidine.
Yes. Yes, very wonderful pointers you have enlightened today. Even the remedies, which actually even I have not used in my practice, but now I will definitely going to use it, especially for the alopecia. You have shown that Vesbidium and all that small remedies, how to utilize, and what the patient will tell us, like you have told about entangled hairs and all that. So these are the very great pointers of today, and definitely this is going to help the early practitioners. तो एक कॉन्फिडेंस आता है कि सर ने किया है, सर ने यहाँ पढ़ा है, सर ने इस तरीके से किया था, तो हमें भी उससे फायदा होगा. और ऐसे ही क्वेश्चंस मुझे बहुत बार इंस्टाग्राम पे या डीएम्स आते रहते हैं कि हमें किस तरीके से कॉन्फिडेंस लाना है. तो कॉन्फिडेंस वो इसी तरीके से, जैसे सर ने अपनी लाइफ में इतना स्ट्रगल करके रोज पढ़ते हैं, आज भी आफ्टर 25 years, if he is reading the books, if he is attending the seminars, this is the only way you can improvise yourself. So don't think, जिस दिन I remember I should not speak, like my husband always says me कि if you have like मुझे सब आता है, then you are like finished. You cannot improvise yourself. अगर आपको ये लगता है कि आपके अंदर कमी है और उसको मुझे किसी भी तरीके से फुलफिल करना है डेली, तो आपको रोज वो एक एंथुसियाज्म रहेगा कि आज मुझे सीखना है, सीखना है, सीखना है. तो कभी भी ये मत सोचो कि मैं ही सब कुछ हूँ. You need to. Even Dr. Sarkar never says कि I know everything. So after he is of 70 years, after so many years of practice, even Dr. Rajiv Karia never says that I know everything, but he improvises it himself every day. So this is my message to our students. Please read, please see the videos, and not even mine, every speakers, जहां से सीखने को मिले सीखो. जहां से मिले वहां से सीखो, लेकिन सीखो और उसको यूटिलाइज करो, आपको कॉन्फिडेंस आएगा होम्योपैथिक प्रैक्टिस में डेफिनेटली। अगर हमें रिजल्ट्स मिलता है तो आपको ही मिलेगा, डेफिनेटली मिलेगा। इट्स होम्योपैथी हु गिव्स द रिजल्ट, इट इज नॉट अ पर्टिकुलर डॉक्टर हु गिव्स इट। So homeopathy has that wonderful things. Sir, thank you so much for coming to my
Thank you
channel
so much.
after so long planning and everything. Finally we are together on the channel, and I am very glad to see you on my channel. I think people are again want you to be the part of my channel. Definitely we'll plan something, because other speakers are also lined up, because I have a planning for 2-3 months. So I have already planned with other speakers, but definitely after some short of time we'll definitely going to plan some other topics. We are coming after Diwali, we'll plan something with other speakers as well, and with the sir. We are planning with some other projects as well. And once that they are finalized, we are going to tell you everyone. Thank you. Now we are
Thank you so much.
3,000 subscriber family. Recently, this is a big thing for me. And I want to share it with Dr. Rajiv sir that before 2 days, we become 3,000 followers.
Oh,
And I'm very happy that this many peoples are, जो एक छोटा सा मैंने स्टार्ट किया था एंड यहाँ तक पहुंचे का कभी सोचा नहीं था, लेकिन आज 3,000 है। पर अभी भी मैं कहूँ कि बहुत सारे लोग वीडियो देखते हैं लेकिन सब्सक्राइब नहीं करते। तो आप जितना सब्सक्राइब करेंगे मैं उतने और स्पीकर्स को बुला सकती हूँ। प्लीज आप लोग अपने लिए कीजिए, मेरे लिए करो नहीं करो, लेकिन अगर आप चाहते हो कि और बहुत बहुत स्पीकर्स मेरे मेरे चैनल पे आए तो आप थोड़ा सब्सक्राइब कीजिए, ताकि मैं और ज्यादा स्पीकर्स को बुला सकूं। सर, हाउ यू फाइंड माय चैनल्स एंड सब्जेक्ट्स? एनी
superb. Fine,
मैसेज?
good.
थैंक
Message is excellent. Keep on doing it.
थैंक यू,
Wonderful.
थैंक यू सो
And thank you
मच।
so much for my heart. So
थैंक
grateful to you.
थैंक यू सो मच। एंड अब आप लोग संडे एंजॉय कीजिए, लेकिन साथ में पढ़ाई करते रहिएगा। विद दिस मैसेज विल सी यू ऑफ all, and we'll meet after Diwali. Happy Diwali in advance to all of you.
Thank you to all.
Yes, thank you, sir.